On behalf of the IPRO ESRD network, I would like to thank you for joining us today for this pre-recorded module on the care of the frail elderly, considerations for the nursing home patient. There is a general consensus that a geriatric assessment is the best systematic approach for the identification of the frail elderly. The geriatric assessment is a multi-dimensional approach to evaluate the health status of elderly patients regarding physical findings, functional and psychosocial domains in a systematic way. It should consist of looking at activities of daily living, sensory deficits, mobility, including falls, mood and cognition, nutrition, comorbidity, polypharmacy, and social support. It can help to detect underlying geriatric impairment, which would otherwise be overlooked. It can form a starting point for personalized interventions to optimize the patient's independence. A geriatric assessment has shown to optimize treatment decisions, thereby improving quality of life. In today's presentation, we will be reviewing the importance of understanding special needs of the frail elderly dialysis patient, including cognition, physical and emotional assessment, as well as communication needs. We will also be reviewing the importance of building shared knowledge that includes multidisciplinary communication, as well as patient and family engagement, which can help build a community of practice. As a member of the care team, you are responsible for the assessment of the patient both before and after dialysis. Part of a complete assessment is to understand the needs of the patient on dialysis and how it affects them. Elderly patients are the frailest of the ESRD patients, secondary to normal changes of aging, coupled with cognitive changes, multiple comorbidities, high risk of falls secondary to loss of muscle tone, skeletal changes and coordination, as well as psychological factors due to a change in their role in society. These changes, when combined with ESRD, can lead to complications such as anxiety, behavior, level of hygiene, confusion, skin breakdown, dietary needs, depression, mobility, and an increased level of hopelessness secondary to a lack of control over their daily lives. Cognitive skills are the essential qualities your brain utilizes to think, listen, learn, understand, justify, question, and pay close attention. Cognitive decline with a frail ESRD patient can be associated with vascular changes in the brain, such as stroke or dementia, uremic brain as a result from skipped or inadequate dialysis, all of which can affect the way patients process or recall new information. Changes in cognition can affect the way a patient communicates needs such as pain, dizziness, nausea, as well as a number of other physical disruptions that can affect cognitive functions such as a drop in blood sugar. It is important for members of the dialysis care team to have a solid understanding of a patient's baseline to recognize subtle changes that occur in the frail ESRD patient during pre and post assessment. Assessing and potentially adjusting questions related to A&O status may need to be tweaked to meet the patient at their level. For instance, asking a patient the day and time may not be appropriate for the nursing home patient. However, asking them what they had for dinner or what family member came to visit may be a more appropriate question. Changes in a patient's ability to answer questions from one treatment to the next should be a trigger for dialysis staff to escalate concerns, not only to the medical chain of command in the dialysis facility, but communicating changes to the nursing home care team. Changes in cognition can at times be related to general physical decline, the need for treatment or medication adjustments, and dietary requirements, including protein intake and fluids. Building strong relationships will lead to a better assessment for your patient population and increased knowledge on how to care for your patient. In addition to this, open and frequent communication with the nursing home care team will only help to improve patient outcomes. As a member of the care team, you are your patient's best advocate when you understand the way ESRD affects the body. You know what is normal for your patient. As a part of the nursing assessment, you are required to do a pre and post physical assessment, including vital signs, breath sounds, skin integrity, access inspection, including patency, signs of infection, including redness, drainage, and warmth, in addition to looking for generalized body edema. Patients and team members depend on these assessments for safe treatment. When assessments become checkboxes, we lose individualized care and our ability for critical thinking, which can be misleading and life-threatening. Be inquisitive during your assessments. If you find something, look deeper and communicate concerns with the appropriate care team member, including the nursing home staff. And remember, the assessment begins the minute you lay your eyes on the patient. Special considerations to remember when caring for the frail elderly ESRD patient are general appearance, including affect, behavior and anxiety, general hygiene, skin condition, including dryness, tears, breakdown, and bruising, as well as changes in mobility and gait that might require repositioning during treatment. Changes noted from pre and post assessment must be documented and communicated with all members of the care team, including the nursing home staff. For those physical events that might be reoccurring, it is recommended to take a holistic approach to patient-centered care by integrating the nursing home care team into daily huddles and QAPI meetings. Did you know research shows older adults fear falling more than robbery or health issues? While depression is common in older adults, it is not a normal part of aging, and it is important to monitor for signs he or she may be depressed. Physical and emotional symptoms associated with depression in the elderly include lack of interest, sleeping more or less, increased aches and pains without clear physical cause, feelings of panic or nervousness, and changes in mood. It is surprisingly easy to slip into a routine and simply cross things off our daily dialysis caregiving to-do list. However, seniors are less likely to feel an emotional void if their interactions with others are meaningful. It is important to remember that your patients had careers, significant others, families, and passions before requiring elevated care, and by maintaining an emotional connection, we can help increase the feeling of safety and security. This can include talking to them or their families about their lives while you work, having them help if they can to increase the feeling of independence, and recognize that older adults need to prioritize their emotional well-being to maintain a high level of care, no matter what illness or limitations they may have. Remember that factors leading to the need of a higher level of care can leave the patient with a feeling of hopelessness, and by taking care to acknowledge our patient and family's emotional needs, we are one step further to a holistic, patient-centered approach. With the exception of the nursing home care team, dialysis professionals see ESRD patients most frequently, and it is common to develop meaningful relationships with our patients. At times, we see them more than their family. And with that being said, it is not unusual for the dialysis team to become very close to our population. This interaction plays a crucial role in our assessment skills. Because we know our patients so well and we see them so frequently, we often recognize changes before others. However, with that being said, it is important to remember to maintain a level of respect by using formal language, including the use of titles such as pastor, miss, or sir, and to only use nicknames with permission from the patient. Other special considerations pertaining to communication needs include the need to speak slowly and clearly for those patients who may have cognitive delays or be hard of hearing, as well as limiting the use of medical jargon. Taking care not to rush or interrupt a patient can demonstrate empathy and develop a rapport with patients, making them feel more comfortable when expressing concerns. Remember, there are patients who will utilize important family members as spokespersons or advocates, and who translate what their care needs are. They will be an important role in our community of practice. So far in this presentation, we have focused on licensed staff assessments. However, we would like to be clear that a review of systems is not a physical assessment and can be done by anyone, including patient care technicians. In many facilities, patient care technicians are an integral part of the care team as they most often provide the one-to-one patient care. These individuals are the eyes and ears on our floors running the day-to-day treatments. A review of systems is when you, a nurse, technician, or social worker, talk to the patient and collect information by using active listening skills. Questions such as, does anything hurt today? Or when was the last time you were nauseated? Collecting this information contributes to a physical assessment, which involves looking, listening, and feeling for physical changes. While the licensed staff has a final accountability for what happens to the patient, every member of the team plays a role in providing safe and effective care. The idea is for staff to be comfortable in formalizing what you do every day in caring for patients. Often we don't realize we collect information that is important to pass on to the nurse so that it can be shared with the dialysis care team as well as the nursing home staff. Many times this review of systems occurs in a common conversation with the patient. Recognize that collecting this information as a part of a conversation puts patients at ease and oftentimes leads to much better answers. What's important to remember while we develop efficiencies in taking care of patients, it is not about routine care or body memory. Always be present in your work. Recognize that your frail, elderly dialysis patient is different than anyone else, and that you need to prioritize that changes in the elderly can occur very quickly, be easily missed, or that you have forgotten to communicate them. Each time you see your patient, they are different than they were the day before, and you will need to investigate changes from the previous treatment. The focus on quality of care and quality outcomes for the frail elderly patient on dialysis involves a team. Using what you have learned, taking consideration of the individual, and recognizing that not everyone is the same includes involving family members. Always remember the nursing home team is an important part of the holistic centered care. We are all invested in doing what is best for our patient, and recognizing that it takes a village is important to remember. For more information, please reach out to the quality department at the IPRO ESRD network. Thank you.